Good morning or good afternoon, actually, everybody. Welcome to day 37 of Vine Health updates on COVID-19 and on the pandemic. This updates from Vine Health is to keep you informed about what's occurred in the last 24 hours and to give you tips on surviving and thriving during this time. And not just you, but your families as well. You know, it's so important to come together to share tips and share, just share things that we could do to make us all feel well during this time. Initially, I was going to talk about sort of discipline and food and all of that, but I sort of changed my mind and I said, let's talk about children's mental health. Because actually throughout this time, I haven't really talked about mental health in children. I've been very focused on, almost my narrative has been directed mainly at adults, but I feel bad because I think children are a very important part, particularly as our children get into their preteens and their teenage years and looking at their mental health, which we kind of don't really pay too much attention to. So I'll be talking about mental health in children, particularly as the new term has just started, and how their mental health can be better both at home and in the virtual school that they're going. So mental health is important. So if you know anybody who needs to hear about children's mental health, please share this video with them. Like, follow, share. I know you all watch it at different times during the day, and I appreciate everyone who has been sharing my videos. I think we had like 6 or 7 shares the other day, and thank you for every single person who has shared the videos. For everyone who's liked the page, thank you. Please keep liking Vine Health, keep sharing our videos, keep spreading the message, because the more of us talk about this message, the better the community is going to be. We can all share the message, you can all keep talking about it so that we can be better. So it'll be children's mental health today. But first, just to go back to the things that have happened in the last 24 hours, the United Kingdom, thankfully, for the second day in a row, the number of deaths has dropped, and up until 5 o'clock yesterday, it's 449. Bearing in mind that it was 596 the day before that, and yesterday, up until yesterday, was 449. So we'll keep our fingers crossed about what happens today, and we'll just keep praying and hoping that things will start to get better. Bringing the total number now to 16,509. And we're still below the 20,000 mark, so we keep hoping and praying that that stays that way. The admission rates are also falling in London and stable across the United Kingdom. So, but admission rates have been falling day on day for the last 7 days in London. More people are going home than are coming in, and we just are thankful to God for that, because there are many things that doctors cannot do. We do our best, but at the end, we all need that extra grace for things to work. Also, obviously, the care homes are a big concern. The care homes, I think the deaths have doubled in the last 4 weeks. The deaths have doubled in the last 4 weeks, so that's an issue there with care homes, and we just keep hoping that more help is given to care homes. But because they're vulnerable, the people that are in care homes are very vulnerable, and there's just way more deaths than we would like, unfortunately. The other interesting thing about the UK is that, we talked about face masks, and I was saying that, if you have a face mask, wear it. And the United Kingdom is discouraging people from wearing masks for very interesting reasons. The one reason that I find very weird is the fact that if we all wear masks in the road, then we are depleting the supplies for the essential staff. However, many people are making their own masks at home. They are doing their own, they're being innovative and making their own. So I don't think that's a good excuse. They also say that it gives a false sense of security. I think we all know that a cloth mask is not going to prevent the virus from infecting you, but it will stop you from touching your face and rubbing your face. So there are other reasons why people wear masks. So I don't really believe the United Kingdom's reason. That's my personal opinion. This is not my professional opinion. This is a personal opinion page, not a professional opinion. But because particularly as other countries are recommending the use of masks. A country, for instance, like Germany, who actually have managed this pandemic quite well, and have reopened some of their businesses yesterday, have said that their people should wear masks, and also France and other countries as well. So that's interesting for the United Kingdom. The US, there's many protesting. People are protesting about the lockdown in the US. I've never seen a country that is so divided along party lines and along political lines. But people are, they're sort of protesting in America and all of that. And good luck to them. Just practice social distancing so that you don't spread the coronavirus to people around you. And Trump has also suspended all immigration to the United States for now during the COVID-19 period. Well, I don't know. I don't think anybody, who's going to be immigrating at this time? Who knows? I don't know. And for Nigeria, it's now at 665 new infections in total and 22 deaths. So slowly creeping up, but not too high. And they've closed the airspace for a further 2 weeks. If you remember, it was supposed to open on the 23rd of April, but now that has been extended for another 2 weeks in line with the lockdown. So that's what's been happening, and that's interesting for Nigeria as well. We are in the throes of it. Hopefully we've hit the peak and things are getting better. Obviously, as economies start to reopen, there's that risk that there will be a second spike in the infections, but hopefully it won't be as high as the first. So everybody's planning how to come out of this whole lockdown, and it is going to happen. The lockdown is going to end because human beings are healthy, not just because they don't get the coronavirus, but because they have other things that they want in life as well. Oh, hi from Morocco. Thank you for watching. We just talk about about the COVID pandemic, and that's it. I shared it here. So the lockdown is going to end, and there's an exit strategy. So you have to be planning your own exit strategy as well, and how you're going to come back into society, and how you're going to just carry on with life without missing a beat. Without missing a beat, because it's going to end. I think that's all my updates for today, but I want to talk about mental health in children. And this came up because schools reopened yesterday, and most of the time, many parents, you don't really see what your children are going through in school. You only go by what they tell you at home. But now that they're at home, sometimes you can actually, if you get involved in their chats and in their schoolwork, you kind of then start to see the dynamics of the various children and what they're dealing with. I mean, children from ethnic minorities are also, they are also at risk here. They're at risk of things like bullying. They're at risk of bullying on social media. They're at risk of things like being excluded from being part of the clique. As parents, you really, really have to pay attention to this, because I think many times the children don't tell us what they're going through. And many of us, who have our backgrounds from a developing country, you already have a strong backbone. Nobody can really break you, because you have your confidence, you know who you are. You come into another country, or you're born here. Many of these children are bullied and are being, treated badly in some of their groups. So you need to give them tips on how to be strong. We don't want children who are depressed. You don't want children who have a low self-esteem. You don't want children who are not confident. You don't want children who are suffering from panic attacks or anxiety. You need to address this issue and then help them, give them tips on how to deal with it. So first thing you need to do as a parent is discuss. Again, I've dealt with hundreds of children who have mental health issues. And sometimes the root of it, we don't really know, we don't really tackle because we don't know where it started from. And sometimes you blame yourself as a parent, thinking that you're the one that's caused their mental health problem, but actually it's actually come from school or from their friendship groups. And you need to really identify the source, and you need to help them and give them tips and teach them how to deal with it. So one of the first things to do, as I said, is to identify if your child has a mental health issue. And this can manifest in different ways. It might be a low self-esteem, not being confident, not being able to talk, not being able to sort of mingle with their peers, not being able to flex. And, as an adult, you can flow into any group, whether it's a group of people that look like you or they don't look like you. But if your child is exhibiting the signs of withdrawal and not able to talk when others are talking, not able to get involved, that might be a sign that their self-esteem is being seriously damaged. Either by their peers or by their teachers or by somebody, and you need to really tackle and address that. That's one. So identify whether it's anxiety or whether it's them feeling low and depressed. There are children as young as 5 and 6 who are having mental health issues. So we need to really take this very, very seriously. So once you've identified it, you've spoken to the child, not in a judgmental way, but just sort of being open and honest with them and just speaking to them, using phrases like, some people suffer from this, some things are done to people that like this, you know, has anybody in your class ever done this to you? And then teaching them how to respond. You know, you can be open and honest, and you can speak your mind without being rude or forward. It's just that balance of, you know, being assertive, being confident, knowing who you are, and not being arrogant. So if you're a parent and you are watching your children at home, please look out for their mental health. Check their mental health. See what's going on with them. Give them tips on how to respond, how to mingle in a group. Give them resources like books and websites that they can go on to have a look at this. Let them know that it's not just them, because sometimes they feel as though, oh, I'm the odd one out, oh, I'm ugly, or I'm a monster, or my hair looks different, or my skin looks different. And then they start to have this narrative that people have sold to them that is wrong. So you need to let them know that, know that actually, they're perfect just the way they are. They're absolutely perfect. Whether you're white, you're black, you're green, you're yellow, you're perfect just the way you are. And you need to address this. We don't want children that will grow up into adults who are really, really poorly balanced. And I'll have to say that children from ethnic minority are significantly at risk of this. And we see that in many areas. I can talk about this for days because I'm really keen and interested in mental health, as you all know, and the effect of mental health on performance, on outcomes, on choices in life. It is so important that we teach our children to be confident and to know who they are. And if you do all of this and you still are very concerned that your child is exhibiting signs of withdrawal, low mood, hypervigilance, just being on edge all the time, panic, anxiety, panic attacks, or just hyperventilating, any of that. If you think that that's going on and you think that the normal sort of resources are not helping, can I suggest that you speak to your GP? Because there are many other resources that you can go on. Headspace is very good for children. Mind, there's different things, the NHS Choices. There's so many other resources that you can go on to help them with their mental health. And then also encouraging creativity. I normally say that as a child, many of us were so bored that we became very creative and we were imaginative in our minds. And nowadays, we don't have that space for our children. So let them have a hobby, have a business, have something that they're starting. Sorry, I know I'm talking a lot because I'm really passionate about this. So please send tips on how you deal with the mental health of your children. So at any age, from 5 to 21, they all have different needs at different times, and sometimes we believe that they've got this. No, we have to get involved. And I'm speaking to myself as a parent, because sometimes you think, oh, your kids are fine. So that's my discussion today on the COVID-19 pandemic and actually bringing you up to date. I hope you've enjoyed that. I hope it's been helpful for you. If there's any specific tips you need, let me know and I'll bring it on. Please like Vine Health. Like this video, share it, follow the page, just spread the news. And if you've missed anything and you're finding it hard to find the videos, go on our YouTube page and you can watch all the videos on there. So thank you again for watching. Thank you for supporting. Thank you for our new viewer from Morocco. I really appreciate that. Let's know how things are going in Morocco as well. And you guys have a fantastic day. I can't wait to get back tomorrow morning to come and talk to you again about the COVID-19 pandemic. And hopefully we'll all be successful and we'll all come out of this better and stronger, better versions of ourselves. All right, guys. Bye.